In this short video, we'll take a closer look at testosterone levels, especially in women. As I've alluded to in other of my videos, estradiol and progesterone testing is pretty straightforward. Testosterone testing is a lot more complicated. I'm Steve Goldberg from SimpleHormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Most of those are about hormone optimization. There are two factors with testosterone that make it a lot more complicated when it comes to figuring out what an optimal testosterone level is. The first of those complicating factors is sex hormone binding globulin, or SHBG. Basically, SHBG is a protein that floats around in your bloodstream, picking up testosterone and taking it for a ride. It's kind of like an Uber for testosterone. The testosterone that's riding on an Uber can't really do anything in your cells. We'll call that bound testosterone. The testosterone that's been dropped off by an Uber driver is the only testosterone that's actually available for your cells for actual work in your body. That's called free or unbound testosterone. When you add up both the bound and the free testosterone, you get a number that's called total testosterone. So if we're going to do a really thorough blood test for testosterone, we're going to take a look at both the free and total testosterone levels. That gives us a more complete picture of what's going on with your testosterone. So I just did a quick and dirty survey of some of the hormone optimization providers that I know. They're all over the place in terms of what they think about free testosterone and total testosterone, especially when it comes to testosterone in women. I have several doctors who really don't pay all that much attention to the specific testosterone levels, either the free levels or the total levels. They mainly care about the symptoms and the side effects. If a woman feels great and isn't having a lot of significant testosterone side effects, then they feel good about her testosterone situation. I know other providers who don't really pay much attention to free testosterone, but they focus on total testosterone. Still, other providers only focus on the free testosterone levels, and they don't really care at all what the total testosterone levels are. So another complicating factor for testosterone blood testing is that there are big differences among different laboratories in their what are called testosterone reference ranges. There are lots of different labs providers will use to test your blood for hormones, including testosterone. Probably the two biggest ones in the US are called LabCorp and Quest Diagnostics, and there are a bunch of others. But these two labs look at testosterone completely differently. Their reference ranges are essentially, they don't have anything to do with one another. The bottom line is that comparing a testosterone level drawn for LabCorp to a testosterone test for Quest is like comparing apples and oranges. Well, these two complicating factors make it really hard to say the optimal testosterone level for women is X. The main conclusions I'm reaching after talking with hormone specialists are, number one, you need to have your labs drawn and interpreted by a hormone optimization specialist who really understands free testosterone and total testosterone, somebody who gets SHBG and who knows about the symptoms of low testosterone as well as high testosterone. The second thing is that you can't really know what an optimal testosterone level is without knowing the context of which lab is doing the blood analysis. Any hormone optimization specialist worth her salt has a lab that she trusts, and more importantly, a lab that she's familiar with, and she knows what that particular lab's results mean for the patient. The lab value is important, whether it's testosterone, estradiol, progesterone, DHEA, thyroid. All of those numbers are important. But the most important thing is you, the patient. Those numbers help providers know sort of what to do next, but there's an old adage that should always apply. We treat the patient, not the numbers. If you're a patient looking for a hormone provider who treats the patient while being informed by their lab values, their numbers, hit me up at the link that says Find a Hormone Provider, and I'll see if I can find a hormone optimization specialist in your area who can help you with those things. If you are a hormone optimization provider, especially a provider who cares more about the patient than the numbers, but who also understands what the numbers mean, I'd love to help you reach more patients. Click the link at the end of this video that says Join Provider Database, and I'll see if I can find you patients in your area. If this video has been helpful at all, click the like and subscribe buttons and get notified anytime I post a new one. Thanks so much for watching. We'll see you next time.